All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about toll-like receptor 5, okay, and certain bacteria that can stimulate it, okay? So remember, toll-like, we've been talking about toll-like receptors 1, 2, and 6 before this. And remember, we always mentioned that, okay, you can find that on the cell surface of certain white blood cells like dendritic cells and macrophages. The interesting thing about toll-like receptor 5 is, yes, you can find it on the cell surface of dendritic cells, right? Dendritic cells. You can find it on the cell surface of macrophages. But something cool about toll-like receptor 5 is you can also find it on the cell surface of epithelial cells. Okay, so epithelial cells. All right, and that's going to become important when we talk about, we're going to talk about three main bacteria that can stimulate toll-like receptor 5. And those examples that we'll talk about in this video are going to be Salmonella, Pseudomonas, and E. coli. Okay, because specifically, toll-like receptor 5, as we'll see in a bit, can be stimulated by something called flagellin. Okay, so let's make that clear, something called flagellin, which we'll see in a bit. Okay, so let's start with salmonella first. All right, so let's start with talking about salmonella enterica. Okay, so we know that this is a gram-negative bacteria, right? So if we start from the beginning, let's say there's a dude, right, who eats contaminated chicken, something like that, right? So let's say he eats contaminated chicken and it's contaminated, obviously, with the Salmonella enterica. So he eats that up. The chicken goes to the small intestine along with the Salmonella, and then let's go there, right? So if we draw the lumen of the small intestine, right? Let's say this is the lumen of the small intestine. And then let's say we draw the epithelial cells. And of course, as we just discovered, right, those epithelial cells have toll-like receptor 5 on it. Okay, so these are toll-like receptor 5. And then, of course, as we know, dendritic cells and macrophages also have that. So we know the histology and everything of the intestinal lumen is below, remember, the epithelial layer is the lamina propria, right? And in this lamina propria, you can have certain white blood cells like dendritic cells, okay? So they can also respond to the salmonella. So let's say we have salmonella, though, floating around here in our intestinal lumen, right? Now, the thing about salmonella is that it also has flagellin, okay? It has flagellin, it contains flagellin. So let's say the salmonella, and let's say that I choose, let's choose white, right? Let's say this is the flagellin molecule right here. Okay, so let's say that's the flagellin. So what can happen is that the flagellin can actually bind onto the toll-like receptor 5 on the epithelial cells. Okay, so if that binds on the toll-like receptor 5, then the toll-like receptor 5 will get activated. It's actually going to dimerize, okay, and then get activated. So let's write that down. So toll-like receptor 5, once it gets stimulated, right, it's going to dimerize, okay? And once it dimerizes, that's, then it's fully activated. And then, of course, and this, remember, this is all happening on the epithelial cell. So the toll-like receptor 5 will dimerize, and then what's going to happen is inside the epithelial cell, you're going to get a signaling pathway that's going to get activated. And we should be familiar with this because we talked about the same signaling pathway in our previous videos on toll-like receptors 1, 2, and 6. We're going to have the activation of MyD88. That will lead to the activation of nuclear factor kappa B. Remember, this is all happening inside our intestinal epithelial cells. Nuclear factor kappa B will translocate inside the nucleus, as we're familiar with, right? And induce gene expression and lead to the production of cytokines. So then we're going to get a bunch of cytokines that will get released at like what? So we're going to get interleukin 8. We're going to get things like interleukin 1, interleukin 6, TNF alpha, right? Plenty of these. And remember, this is also happening in the dendritic cells, for example, in the lamina propria, just below the epithelial layer. So we're having a bunch of these cytokines get released. Of course, this is going to lead to, right, fever, because if it goes to your blood and then goes to your hypothalamus, you're going to get fever. All these cytokines, of course, will increase vasodilation and permeability, which can lead to diarrhea, right? Because you'll have vasodilation and more fluid overall due to the inflammation that's coming in that will arrive to your intestines, which will lead to diarrhea, right? And of course, all these cytokines, as we've said before, will contribute to the overall process of inflammation. Okay. Something important to keep in mind is interleukin 8 is obviously is good for attracting neutrophils. Okay. So it recruits neutrophils. And you want neutrophils to come to that area because you want these neutrophils to fight off the salmonella in your intestine, right? So it doesn't keep on spreading. And then, of course, as we talked about, TNF alpha, IL-1, IL-6 promotes the usual fever, diarrhea, and inflammation. Okay, so if you have a patient who has a fever, watery diarrhea, recent food poisoning, you can think about salmonella. Okay, so that's talking about salmonella and how that activates toll-like receptor 5. Let's talk about another example, that being E. coli. All right, so let's talk about E. coli. So pretty much a similar thing here too, right? So it's going to be good repetition for learning processes, right? So for learning purposes, sorry. So let's say you have your intestinal lumen, okay? Got an intestinal lumen here. And same thing. So let's say you got a person, right? Someone who's traveling. Okay, that's key. Someone who's traveling and drinks contaminated water, for example, and that water was obviously contaminated with E. coli. Okay, that can lead to traveler's diarrhea. So let's talk about that. So let's say the E. coli makes it down to the intestines, right? And let's say we have our epithelial cells here, and we have our E. coli here, right? We have a bunch of E. coli here trying to take over. Okay. And it turns out E. coli also has flagellin. And remember, who does flagellin activate? Toll-like receptor 5, right? So let's draw the flagellin in green. Okay. And if you have your toll-like receptor 5s, right, or toll-like receptor 5 on all these epithelial cells, right? Obviously, this is going to lead to the activation of toll-like receptor 5 because the flagellin is recognized by toll-like receptor 5. So again, what's going to happen is flagellin will bind onto the toll-like receptor 5, which will lead to the activation of toll-like receptor 5, right? So and so we said that toll-like receptor 5 will actually dimerize, then it'll be fully activated. Then inside the epithelial cell, we're going to have signaling pathway that gets activated. As we were familiar with now, that's going to be the MyD88 pathway. That pathway actually will lead to the activation of nuclear factor kappa B, right? Nuclear factor kappa B will translocate into the nucleus. Remember, this is all happening inside the intestinal epithelial cell. Okay. Nuclear factor kappa B will translocate inside the nucleus, induce gene expression, leading to the production of cytokines. Now, what are those cytokines, right? So we're going to have production of cytokines from the epithelial cell. So what are those cytokines? Again, same cytokines, right? Interleukin 1, we'll get interleukin 6, interleukin 8, TNF alpha, right? A whole bunch. As we know, interleukin 8 is good for recruiting neutrophils because you want the neutrophils to come to the area where E. coli is infecting the intestines, right? So you want to fight off that E. coli. Of course, TNF alpha, interleukin 1, and interleukin 6, right, will lead to fever, diarrhea because of increased intestinal permeability. So you'll have watery diarrhea, right? And you'll have fever, of course, because in general, cytokines can go to your hypothalamus, and that can lead to a fever. And then, of course, cytokines in general can also contribute to the overall process of inflammation, as we are familiar with. Okay, so that's basically um, how traveler's diarrhea works. Okay, how E. coli activates toll-like receptor 5 in your intestinal epithelial cells, or on your intestinal epithelial cells. Okay, so if you have a patient who gets non-bloody diarrhea after drinking contaminated water, you can also have E. coli in your mind. All right. And just know that E. coli activates toll-like receptor 5, leading to a bunch of inflammation and diarrhea. Okay. The other example that we want to talk about is also E. coli, but remember, E. coli can cause urinary tract infections also. So that's important to keep in mind. So we're going to talk about E. coli again, but in this case, we'll be talking about urinary tract infections because E. coli can also cause urinary tract infections, right? If they're uropathogenic. So the way this works is it's similar, right? Once we get down the basic process of the activation of toll-like receptor 5 and what that leads to, then we can apply that to many scenarios. So remember how we'll talk about UTIs and we talk about in our when we make our renal playlist. Um, but remember, E. coli, right, can obviously ascend up the urethra, so up the urethra, and then eventually it can reach the bladder, right? So let's say eventually reaches the bladder. So let's say this is our urethra, and we draw our E. coli like this, right? It's like it's coming up the urethra, it can ascend up the urethra and eventually reach the bladder. Okay. So that's gonna and of course the bladder, right, has epithelial cells. So it's lined by epithelial cells. So we can go and draw that out. So, right, that's lined by epithelial cells. And what did we say epithelial cells have? Toll-like receptor 5. Okay. So we got toll-like receptor 5 on our epithelial cells. Let's draw that equally same. And of course, E. coli, as we know, has flagellin. So let's draw flagellin, right? So this is going to be flagellin. And we know flagellin is recognized with toll-like receptor 5. So it's going to activate toll-like receptor 5. And then once we know that, it's the same process, right? So, and of course, you have resident macrophages in your bladder too, right? But what we're talking about, epithelial cells here, since it's kind of a special case where epithelial cells also have toll-like receptors. So we're used to hearing toll-like receptors on white blood cells. So let's just focus on the toll-like receptor 5 on epithelial cells. So flagellin from the E. coli, from the uropathogenic E. coli, will bind onto the toll-like receptor 5 on our epithelial cells that line the bladder. Then from there, we already should know it, right? Like in the back of our mind, we should already know it pretty well now that when toll-like receptor 5 is activated, it's going to dimerize. Okay. Once it dimerizes, right, that's when it's fully activated. And then, so let's actually draw it out right here. So we're going to have dimerization of toll-like receptor 5, right? That means that toll-like receptor 5 is now activated. Activated toll-like receptor 5 activates our intracellular pathway that we're talking about, right? Which is MyD88. So then MyD88 gets activated. This is all happening inside our epithelial cells that line the bladder. Okay. Once MyD88 gets activated, that leads to the activation of nuclear factor kappa B. And we know nuclear factor kappa B translocates in the nucleus, induces gene expression, leads to the release of many cytokines. Like what? Like interleukin 1, interleukin 6, interleukin 8, TNF alpha, and so on, right? So, of course, we know that interleukin 8 attracts neutrophils, which obviously will lead to pus formation. So attracts neutrophils, which will lead to pus formation, which is why you see pyuria, right? In like UTI caused by E. coli, due to interleukin 8 activating neutrophils, because we know pus is formed by neutrophils, right? So if you have pus in your urine, that would be pyuria, which can be a symptom of or finding of UTI. And then, of course, we know that all these cytokines, especially 1, 6, and TNF alpha, can cause overall inflammation. And we know the common findings of a UTI, especially a UTI involving the bladder, which is urgency, frequency, dysuria, right? Especially in this case. So urgency, frequency, and dysuria, look for those. You can also have suprapubic tenderness or super pain in the suprapubic area, but these are the main findings that you expect, right? In a UTI that affects the bladder. So if you have someone that has dysuria, so pain when they're urinating, and obviously urgency and frequency, and if you look at the urine, right, analyze the urine, you see white blood cells and pyuria, right? Then obviously that should maybe be a clue, or you should have in your mind a possibility of a UTI, right? In this case, we're talking about E. coli as an example. Okay, so that's the example for E. coli. And our last example that I wanted to talk about is Pseudomonas, because that also has flagellin. Okay, so let's talk about Pseudomonas. Pseudomonas aeruginosa. I won't write that part out, but we know that that's the full name, right? So an example of this would be a patient who has cystic fibrosis, right? And so we know with cystic fibrosis, you're going to produce a lot of mucus, right? A lot of mucus, and you won't be able, it'll be very thick mucus, and because you can't really push chloride right into the lumen, so then water can't follow. So you're gonna have thick mucus and a bunch of mucus production. But we'll go over cystic fibrosis in a future video too. Um, so cystic fibrosis patients are at increased risk of Pseudomonas infection, right? Which we're familiar with. And so what that happens is Pseudomonas will make its way down, right, to the lungs, obviously, because that's where the infection's occurring. And of course, we know that Pseudomonas has flagellin in it, and we know flagellin activates toll-like receptor 5, right? So let's say we draw something right here, like a alveoli or just the lung epithelial cells, right? So let's say we have our airway here, and it branches out, of course, and then we're going to have our lungs right later on, and we know that it branches our airways, or the bronchi branches out, and then eventually you have small bronchioles, right? And then you're eventually going to have your alveoli, your air sacs, right? So if we zoom into these air sacs, or if we look at, even like, let's say you look at part of the airway, right? Part of the airway, so let's draw that bigger, part of the airway, and you zoom into the epithelial cells, right? Zoom into the epithelial cell. These epithelial cells will have toll-like receptor 5, like we've been talking about, right? So this is going to have toll-like receptor 5. And let's say you have obviously a lot of mucus that's plugging this area, right? And with a lot of mucus, especially in cystic fibrosis patients, we know they're at increased risk of Pseudomonas infection. So let's say you have a lot of Pseudomonas that's accumulating here. And on the Pseudomonas, we know we know Pseudomonas contains flagellin. So flagellin can bind on the toll-like receptor 5, stimulate that, right? Which will lead to dimerization, which is actually how toll-like receptor 5 gets stimulated. So, of course, this will lead to toll-like receptor 5 dimerization, and then that will lead to MyD88 stimulation, right? As we've already known many times now, we've gone over this. So this is actually good, it's more practice. And then after MyD88 gets stimulated, right, we know that that's going to activate nuclear factor kappa B. That will translocate into the nucleus and lead to gene expression and the release of cytokines like interleukin 1, 6, tumor necrotic factor alpha, interleukin 8. We know all that's going to contribute to inflammation, attract neutrophils, which will lead to more airway damage, right? And it's going to worsen lung function in patients with cystic fibrosis. Okay. So that's how Pseudomonas works in terms of activating toll-like receptor 5. All right. So I know this was probably a long video, but I just want to go over some examples that lead to the activation of toll-like receptor 5. I hope this video helped. Hope it wasn't too confusing. And I hope to see you guys in my future videos. Thanks for watching.